This is the annual cooperative agreement training for animal disease traceability for fiscal year 2019. For 2019, we have 4 overarching goals for ADT funding. These were presented by Undersecretary Ibaugh last year and are basically our marching orders for traceability in the United States. Those 4 overarching goals are to advance electronic sharing of data among state and federal officials, veterinarians, industry, and particularly sharing data to the Animal Health Events Repository, the AHER. AHER doesn't require private producer information, but allows people to find the data they need. The second one is using electronic ID tags for animals requiring individual identification. Third is to enhance the ability to track animals from birth to slaughter and at critical points between. And the last goal is to elevate the discussion to work toward a system where animal health certificates are electronically transmitted from private veterinarians to state animal health officials.
The following slides include specific activities cooperators will undertake in their ADT Cooperative Agreement work plans to support the ADT priorities. Number 1, Traceability Performance Measures. ADT is a performance-based program designed to measure outcomes that will document successful advancement of ADT. TPMs have been established as one method to measure and document progress. ADT recipients, in cooperation with the program manager, will administer annually TPMs that reflect tracing capabilities based on the defined activities. Compilation of the results across all recipients will enable APHES to determine current traceability values for the TPMs, to document progress made from the national baseline values and subsequent comparison years that were established in prior cooperative agreement periods. Guidelines provided for the administration and completion of traces, trace exercises, or actual traces must be followed, and quotas must be achieved to maintain eligibility for reimbursement of expenditures. Recipient work plans must detail the following elements for TPMs. Number 1, provide an overview of how the recipient will administer traces to complete the assigned number of TPMs in the Emergency Management Response System 2, or EMERS 2. States that had TPM values below the acceptable rating category for elapsed time and/or percent successfully completed in the 4th year comparison, which would be the 2017 cooperative agreement period, shall identify actions or activities they will implement to improve key tracing capability indicators. The state's 2017 TPM rating report is to be used to determine which TPMs are applicable for this work plan requirement. The recipient should contact the program manager if the report was not forwarded to them previously. Number 2, recipients that identify potential compliance issues in the course of administering TPM shall report enforcement actions to their AVIC for inclusion in the VS Quarterly ADT Enforcement Action Summary Report. That second requirement is new for this year. As you work through TPMs, any compliance issues that are noted in completion of TPMs need to be dealt with enforcement actions or compliance actions and included in that VS Quarterly Report. Number 2, administration of official identification devices. The recipient must explain how official identification devices will be made available to producers and plans for increasing the use of official RFID tags and reading devices. Explain how the RFID tags will be read electronically and data collected after the initial application of the tag to ensure the technology is appropriately utilized. Number 2, explain how the recipient is maintaining records of official identification devices distributed and/or applied to ensure timely retrieval of such records when needed, including devices administered through accredited veterinarians, markets, tagging sites, etc. New this year is explain how tag distribution records for tags provided to veterinarians are monitored. In the cooperative agreement workbook that you've all received, you'll see quarterly and final reporting tabs to report the number and type of official identification devices distributed and/or applied. Advancement of ADT requires activities that will make electronic information more readily available. Technologies such as radio frequency identification tags, readers, and associated electronic interstate movement documentation must be given a high priority in the work plan and must include a description of how ADT funding is to be applied to increase the use of RFID devices. Recipients must include activities that support and advance official identification and record keeping for the distribution of official ear tags in their quarterly and final accomplishment reports. On the next slide, you can see the table that's included for recording of official identification device type issued by the cooperator, species, and number that's in those quarterly reporting tabs in the ADT workbook. Number 3, information sharing. Sharing information quickly and effectively will help APHES and its recipients respond to animal disease events and make ADT successful. The collection and storage of electronic records, along with the ability to share that information, is critical. Therefore, all recipients must adhere to defined data elements for official identification and interstate movement information in accordance with accepted data standards, specifically ISO 11784 and USAHA Electronic ICBI or eCBI XML schema, respectively. Integration of systems and/or communication processes to support efficient data sharing options must also be documented in the work plan. Enhancing existing systems or applications to utilize recognized standards for sharing data, for example, developing the ability to send or receive the USAHA standard eCBI XML message, and integrating data systems is necessary. The cooperator will need to explain what information systems are being used to support traceability and describe the process and in what format APHES and other states will be provided access to that data when needed. New this year, recipients must include a description of systems utilized for the distribution of official identification, program disease, and movement record keeping. Contributing summary data from state systems, for example, USA HERDS or Core 1, to the AHER is a high priority for ADT. Therefore, states must work with VS counterparts to develop a plan for sharing key data elements such as tag number, date, event type, state, prem ID of producer or state office, and the system holding the data with AHER from their systems that support traceability, including the timelines for implementation of that integration. Number 2, recipients who have developed or obtained their own information systems should explain how their systems are aligned with established data and communication interfaces to ensure compatibility of information systems. Number 4, electronic records. In addition to the key elements noted in the ADT roadmaps, activities to increase the volume of electronic records that optimize the searchability of potential ADT data shall be described. Priority areas to consider include distribution and application records of official identification devices, ICBIs, and other sources deemed applicable for the recipient. Note, searchable eCBIs are linked to a data system where data fields may be retrieved electronically. PDF images of an ICBI created in either a fillable format or handwritten, may be attached as a file. These are not considered a true eCBI unless the individual data elements are searchable. The work plan must describe the recipient's approach to increase and track the utilization of electronically searchable eCBI systems by accredited veterinarians. And on this slide, you can again see a screenshot of the table that is required under the quarterly reporting tabs for recording information related to electronic CBI use within the state. Number 5, outreach. Implementation of an outreach plan for the recipient's approach, including timelines and goals, is vital to support ADT. Recipients should focus on outreach events with producers that demonstrate the value of ADT, including understanding of electronic animal ID, premises ID, timelines, regulations, and exercises or demonstrations of real-world scenarios for what traceability means for a producer. New this year, recipients are encouraged to conduct tabletop exercises in cooperation with federal personnel and use models or resources provided by APHES. And as you can see, the screenshot on this slide includes the table that has been used in previous years for reporting outreach activities conducted in each quarter. And finally, for the activities compliance and enforcement of traceability regulations. High compliance with traceability regulations is also critical to achieve optimum tracing capabilities. While APHES is the lead on the regulations defined in 9 CFR Part 86, recipients are encouraged to work cooperatively with federal resources on activities that will support compliance and enforcement with ADT, particularly when the state has regulations that align with federal regulations. So number one, under this activity, the recipient will, in collaboration with the program manager, document processes to examine and report compliance with ADT requirements and enforcement actions taken for official identification and interstate movement defined in 9 CFR Part 86. To avoid duplication of reporting, the state should provide their ABIC with counts of enforcement activities to augment the VS quarterly ADT enforcement action summary report. New this year is ensuring that accredited veterinarians and other tag managers that acquire official identification devices directly from manufacturers keep accurate records of tags distributed and applied as a high priority. Recipients must document efforts that will be taken to ensure compliance with this requirement. On this slide, you'll see a screenshot of the ADT detailed financial plan. Recipients must use the ADT Cooperative Agreement Financial Plan Excel template to document planned expenditures to support the work plan. Work plans submitted without this financial plan Excel template will be returned to the recipient. Please note that the last row in each category is unlocked so that additional rows can be added as necessary within each category.
This slide shows the program manager checklist that you've seen in previous years. It has a couple of new additions to it. Its use is for the program manager to evaluate the work plan and the work that the cooperator will do under the ADT agreement. The checklist includes the 6 categories of activities that we've just described, as well as a roadmap. A roadmap is a strategic plan or a plan for actions that the state is going to take for their ADT program and implementing it. The other addition is the successfully achievement of prior year's goals. That's not to say that states that have had circumstances that prevented them from achieving some of their goals should have any changes in their funding. For example, some states have had natural disasters or disease outbreaks that have prevented them from meeting some of the requirements. But states that have chronically not used their funding or not achieved their goals year after year would rank low on this category and probably would be subject to discussions of changing or reducing the funding for the coming year. The way that this works is for each of these 8 categories, the program manager would review the work plan and the work that's been done and give a score of 0 to 10. As those scores are totaled, the final total score then would give an evaluation of the ADT agreement. A score that was less than 100% might indicate a need to increase or decrease funding. If a state is insufficient on some of the categories, not achieving them or not needing the funding to do those or not achieving those goals, then that might indicate that a reduction in the cooperative agreement is indicated. Likewise, a state may have lower scores because they simply don't have enough funding to meet the needs. And in that case, their agreement amount may need to be increased. For fiscal year 2019, there's additional funding for EID readers. This additional funding would help to build infrastructure, particularly with accredited veterinarians and markets. The funding would be available through the same cooperative period as the annual agreement. The devices that are purchased must be compatible with the Mobile Information Management System, the MEMS. In order to apply for the additional funding, the cooperator should submit a Word or PDF document as an appendix with their work plan. It doesn't need to be a long description of the work, but it needs to be adequate to provide an understanding of how the money is spent and how it's used to build that infrastructure. The cooperator should also provide a second financial plan including the additional funding. That secondary financial plan would be included in case the funding is approved. Funding amounts would be approved on a case-by-case based on the proposal that was submitted, and the funding request would be due along with the package by May 10th as a due date. Must be received before May 10th. The amount of additional funding will vary depending on the proposed activities for the states, but will most likely be around 10% of the original agreement in addition to that agreement. For questions or comments, the animal disease traceability mailbox is available at traceability@usda.gov, and the ADT staff is available to answer those questions either by emails or by direct comment. Thank you.